from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about aging, cognitive decline, and methods to reduce the risk of dementia. Our guest today is Danielle Valerie, the program manager for the SMH Memory Disorder Clinic. Danielle, thank you so much for joining us.
Thank you for having me. Super excited to be here.
What exactly is dementia?
So when we think of the word dementia, I want people to understand that dementia is a symptom. It's not a disease. So basically what happens is when we're explaining to people that are going through cognitive changes, dementia is an umbrella term that describes symptoms. It's cognitive decline coupled with functional decline. And when those two meet, that's when we come up with the word dementia. And that symptom is based on a disease, whether it's Alzheimer's disease or vascular dementia. There's several others that we can get into a little bit later. But yeah, I want people to understand that it is a symptom.
So that kind of answers the next question, but how do you help people tell the difference between Alzheimer's and dementia? Because I think most people who think of dementia immediately think of Alzheimer's.
Correct, because that's the most prevalent disease that causes dementia.
Okay.
So when we think about it that way, when we're measuring people for cognitive decline, we're trying to determine, number one, what's normal aging, what's not. So we're looking at 5 key areas of the brain. We're measuring visual spatial skills, language skills, attention, of course, new memory / learning, and then executive function. When you have impairment in one of those domains, plus what we call functional decline, so that means independent activities of daily living, such as can no longer cook correctly or shop, or maybe your bill paying is not exact, or a decline in activities of daily living, which is bathing, dressing, that type of thing. So when you pair functional decline and an impairment in one of those cognitive domains, that's when you meet the diagnosis. Well, that's when you meet dementia, and then the diagnosis is either Alzheimer's disease or vascular or Parkinson's, one of those other types of diseases.
So now that we understand that dementia is a symptom, not the disease, why does dementia occur?
For lots of reasons. I think that, of course, people are worried about having a gene, a genetic component to it. There are risk factors that we're coming out with better science through research to be able to identify those risk factors if you're going to get Alzheimer's disease. I think that our vascular health is very important. My father-in-law, for example, suffered from vascular dementia. It's a different type of dementia. It doesn't necessarily focus on memory loss. It has other areas. You're just slower to react with certain things. So when we diagnose the disease, we want to make sure that we're identifying all the different parts that are causing, this dementia. Are you a diabetic? Are your numbers in check? The risk factors that we can control are going to help us in the long run so that we don't develop dementia through, vascular disease, vascular risk factors, age, things like that.
You mentioned a few of the most common risk factors. What are all of the risk factors that people should really be aware of?
So, basically, know your numbers. When you go to your primary care, we always tell people what we can control is our vascular risk factors. So making sure your numbers in check, whether that be cholesterol, high blood pressure, anything that you can control to reduce your vascular risk factors. Then also it comes down to making sure you're eating a healthy diet. Mediterranean diet is the most researched diet for both cognitive health and for cardiac health. So that's a no-brainer there. A lot of people are already kind of doing that. Weight control, proper sleep hygiene, things like that. We have a list that we give to people in the memory clinic to kind of reduce your risk for dementia that we also tell people about. Hearing, for example, is another big one. If you don't treat hearing loss when it happens, you are 5 times more likely to have cognitive decline.
That's interesting. Is there a way to completely prevent dementia, or how can those risk factors be mitigated?
Most of the mitigation comes, again, from those lifestyle choices, the ones that you've done previously and what you continue to do throughout your life. People don't even realize, but making sure you're flossing and brushing your teeth and removing that plaque, that can lead to cognitive decline as well. That plaque builds up, it goes to the brain. It is one of the things that they've identified as a risk factor for getting dementia, or for getting Alzheimer's disease, I should say. So mitigating your risk would be, again, making sure that you're eating a healthy diet, that you're exercising. Cognitive fitness is just as important as physical fitness. People need to focus on cognitive fitness, especially for us that are, or people that are getting into that retirement age where they're no longer, going go, and now they're retired. So they need to stay active from a cognitive standpoint.
Can you talk a bit about how family and friends can help someone they know who's aging to try and prevent that cognitive decline?
So I think really it is about the support and making sure that they're identifying if their loved one is at risk or having risk factors, and to motivate them to do things. For example, I have clients that are patients that have come through the clinic, and they'll say, well, mom's just not motivated to exercise, or if I ask my wife, let's go for a walk, she always says no. You have to understand that even people, if they already have this dementing cognitive dementia going on, as long as they are staying active and doing the things like exercise, eating right, it does still help them in the long run. So sometimes we have to change the way we say things. Instead of asking for someone to do something, say, hey, it's time to get outside. It's how we phrase what we want them to do is how we can help motivate them. Because a lot of times if you ask someone, do you want to go do some physical activity? I think their answer may be no. But if you say, hey, we're going to run an errand and take a walk, or, just less is more.
How can someone tell the difference between normal aging and dementia?
So we have literature that's available through the clinic, but normal age-related things are things like being forgetful once in a while, even missing a payment on a bill. Those types of things are normal age-related changes. We talk about dementia. It is when those things happen so frequently and they interfere with your ability to function on a daily basis. That's when it's more serious than just age-related forgetfulness.
So when should family and friends who are looking at some of these behaviors, when should they wave the flag or ask for their loved one to seek medical advice?
I think, and Medicare also thinks, that people, because it isn't part of their annual wellness visit, for some type of cognitive screening to be performed during the annual wellness visit, okay? And I don't, they didn't say what needed to be performed, for example. They're not administering a test like we are, something called the MOCA or the MMSE, the mini mental exam. So a lot of times primary care says, okay, go to the memory clinic or go to someone to evaluate this. So at least start at 65, because that's when we do see a change that is from normal aging to something called mild cognitive impairment, okay? And that's kind of, in my opinion, when somebody should start, at least at 65, if not 70, at least by 70.
So if someone is referred to your clinic, to the memory disorder clinic, what are the steps that are taken there? How might it actually be diagnosed that they are exhibiting signs of true dementia?
Right. So our clinic, so we offer two different types of services. We offer a free memory screening, or we offer a diagnostic evaluation. If somebody is not really motivated to get, the full diagnostic evaluation, a lot of times we can explain that this is about your brain health. It's very important, get that baseline and come at least do our baseline free memory screening. This will give us an idea, because it is a normed test, how someone performs. So if I know they're in that abnormal range, it doesn't mean that they have dementia, but it means they didn't score in that normal range and probably should benefit or would benefit from a full diagnostic evaluation.
And then if they do have that diagnostic evaluation, what happens from there?
So we're trying to put the story together. It really, until recently, you couldn't really diagnose Alzheimer's disease indefinitely. It had to wait till you were dead and you had an autopsy of the brain to see that there were amyloid proteins on the brain. But not everybody that has dementia has that amyloid protein. So we're putting the pieces of the story together. We're asking people how they, what they're noticing, what their symptoms are. They will tell us the story. Then we typically take a picture of the brain. We want to see, is the brain aging more than it should for your age? There's things that you can measure there. There's even a structure in the brain that's called the hippocampus that can be measured to see if that's shrinking more. And the reason that that's important clue is because that's where memories are made and stored, okay? That's the memory center of the brain. And then we're also paneling that with a medication review, as well as certain lab work that we know is, if you're deficient, can cause cognitive changes. And then the most important, or one of the most important parts, is that neuropsychological evaluation, because that really puts your brain through the paces.
So once it's been found that someone is exhibiting symptoms like dementia, what treatment options are available? What does it look like for them? Is that it?
So of course I guess it's been on the market 2 years, almost 3 years now, the Leqembi, and then there's a couple of others that have followed now for treatment. And the treatment is really specifically for, you have to have certain positive factors, like they'll do a certain scan called a PET scan to make sure that you have the amyloid protein on the brain. And the reason for that is because, for example, if you have vascular dementia, you're probably not going to have a PET image, positive amyloid image of the brain. And you don't get treated with Leqembi because the way that medication works is it erases that amyloid from the brain. So that's not going to help you. So yeah, other than the newer treatments that are out there, and your doctor needs to evaluate with you your plan of care and your risk factors, what's left is really all those lifestyle things we can do, and then the treatments that have been on the market for many years, which are basically, they're not disease-modifying treatments, but they help with symptom management. So that's Aricept and Memantine.
What role do family and friends play for someone who has been diagnosed with something that is causing dementia?
So it is important, and the reason that I feel it's very important, especially for us living here in this community, is to be able to support the caregivers that are caring for people, whether it's a spouse, a child, even a grandchild, a neighbor, because a lot of times people financially cannot afford to be put into certain facilities for care. If they're in that in-between and they don't qualify for state assistance. So we need to make sure that we're supporting that social network, and that's what I try to do in my clinic, to give the caregivers the support and education they need so that they can care for their loved one as long as they can out in the outside environment of their home and not being placed. Because what happens more is that if the caregivers don't have that support and education, they wind up sick, and then that person that's having the cognitive problems, they wind up in the system.
What do you want people to know when it comes to preventing dementia risks or getting diagnosed?
Again, I think it's really about a brain health evaluation. I think we need to destigmatize the negativity of dementia. I mean, what does it mean? It means dementation, right? When I was younger, it was like, oh, they have cancer. We used to whisper the word cancer because if anyone said that word, you would get it, And it's like the same thing with dementia. A lot of times I find that people don't even want to share that they have a diagnosis of Alzheimer's disease or vascular disease because they don't want to be looked at by their peers and stigmatized. So part of what we do as the Sarasota Memorial Memory Disorder Clinic and statewide, because we get funding through the Alzheimer's Disease Initiative, is to help educate in the community through the Dementia Care and Cure Initiative people about the advocacy, awareness, and the signs and symptoms of cognitive decline and how to support people in the community living with this disease.
For those who are in the Sarasota community looking for more information or maybe looking to even get that free screening, what should they do?
They can call, so we have RAC cards that are made through the Dementia Care and Cure Initiative, but they can call the Memory Disorder Clinic. My staff is trained. They know where to refer people. We do free memory screenings in Venice at the Senior Friendship Center. We do them Newtown in Sarasota, SMH Newtown, at my office. I go to the public library and do them every quarter in different areas of Sarasota County. So they can simply call and at least start there with that free memory screening. And then if they need more resources, we have our resource rack card with all the nonprofit social service agencies in the area that deal with caregivers and helping that type of situation, education and support.
Well, thank you so much for joining us and answering all these questions, Danielle.
Well, thank you.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.